evening and welcome. I am Amarachi Ubani. Tonight, panic in Cross River State over suspected case of polio as federal government swings into action. Troops repel attack by fleeing Boko Haram members in Madagali, Adamawa State. Head of Service of the Federation hints of imminent reforms in the Federal Civil Service. And head of Gambia's Electoral Commission flees the country following alleged threats after Yahya Jammeh lost the presidential election last year.
And on business news tonight, crude oil prices fall sharply after hitting 18-month highs as producers' supply cut deal begins in January.
And on sports news tonight, Premier League champions Leicester City completes the signing of Super Eagles midfielder Wilfred Ndidi for £15 million.
And from Abuja, I'm Linda Akibe. Staff of the People's Democratic Party protest continued closure of the party's national secretariat in Abuja by personnel of the Nigeria Police.
We begin tonight with what seems to be a fresh health challenge for the nation following the suspected outbreak of poliomyelitis in a community in Odupani, local government area of Cross River State. It was discovered in a child whose relative, who spoke off camera, said the toddler started showing signs of paralysis months ago, and the only health facility in the area could not handle the case. But the Director General of the Primary Healthcare Center insists that the state is polio-free.
2 weeks ago, we just had the maternal, newborn and child health week, where we were able to reach out to over 760,000 children with vaccination at our health centers. We heard of this and we have sent the surveillance team. They are already on their way to Dupani, and they would pick up samples from that child and they will send them to the laboratory, and within the next 3 days to 1 week, we should have results to say if that is a case of polio or not. When it's a case of confirmed polio, then we would set into action the remaining modalities and strategies to ensure that we can be able to contain it at source and get every child around that area fully immunized. And so for us in Cross River State, we are ready. The entire health team, we are ready for whatever the results might be. But for now, Cross River State still remains polio-free. WHO has been alerted, and they have equally moved into the field to see the child do the examination, pick up samples, and send to the lab.
It has been a tortuous journey for Nigeria, as you may know, polio status. In our next report, we take a look at the turning point for the nation and how efforts have been made towards ensuring that awareness is created for immunization, particularly in northern Nigeria, to assist the campaign against polio.
It's been twists and turns for Nigeria in the country's quest to kick polio out. Take a look at the trends of wild polio virus cases in Nigeria between the year 2000 and 2016. In the year 2000, there were 29 cases, which went up to 58 in 2001, 202 in the year 2002, and 355 in 2003. The controversy over the safety or purpose of the oral polio vaccine led to a boycott of the vaccine in northern Nigeria, and this resulted in a sharp rise in the number of cases, with 792 cases recorded in 2004, 830 in 2005, and the peak of the disease in 2006, with 1,122 children paralyzed by the polio virus.
This vaccine has been used in almost all over the world, more than 10 billion doses. The empirical evidence to say that it is not safe is not there.
With concerted efforts on routine immunization, supplementary immunization days, and increased surveillance, the turning point came in 2014 with only 6 polio cases recorded in the northern part of Nigeria compared to the 53 recorded in 2013. To deal with the present polio situation, the Federal Ministry of Health, in collaboration with development partners, has directed the deployment of a national emergency team to Borno and neighboring states such as Yobe, Adamawa and Gombe to rapidly boost immunity of children in the affected areas through immediate and robust polio vaccination campaign.
Meanwhile, a team of experts have been dispatched from the Federal Ministry of Health and the Nigerian Center for Disease Control to Cross River State to investigate the suspected polio case. The Minister of Health, Professor Isaac Adewale, confirmed this to Channels Television in a phone conversation. The minister said although he suspected the child's leg may have been a case of deformity known as clubfoot, the ministry will reveal its findings as soon as proper diagnosis is done. Fresh cases of wild poliovirus were detected in Nigeria's northeast state of Borno in 2016, dashing the country's expectations of attaining polio-free status after 2 years of non-occurrence of poliovirus. The federal government had responded swiftly by deploying large-scale immunization and surveillance systems to prevent more children from becoming affected. From the narrative of the relative of the polio victim, we understand the health center in their area could not cope with the child's case. And going forward, there appears need for authorities to reappraise the infrastructure available at the primary healthcare level. This takes us to our next report, which assesses the state of Nigeria's primary healthcare delivery. Our correspondent, Mary Alale Yusuf, reports.
The Okaka Community Primary Healthcare Center in Yenagoa, Bayelsa State, South Nigeria, is saddled with the responsibility of providing basic healthcare services to the residents in this corner of the state. But the center is suffering from a sad lack of attention. They have not been supplied with drugs or equipment since 2014.
80% of what we have here, we did it ourselves. I can say due to the little work we've been doing, we've been able to buy 1 or 2 things. We have an improvised labor bed. We've applied to MDG twice to help us with beds, which they've not responded to.
At another center in the heart of the city, the tale is no better, with the health facilities situated on a temporary site. Space is limited, and a lot of the equipment is stored outside. At a center in Cross River State, it's the same story. The place is seen to be manned by 1 nurse, but the state government says that will soon change. A one-time official of the Nigerian Medical Association in Ogun State, southwest Nigeria, laments a situation where people visit tertiary health centers to treat malaria and get vaccinated. Cases, he says, should be handled at the lowest level of care.
Number one, it is cheaper and it's better to run. And more people will benefit from it than curative that you have to go to all these tertiary centers.
Centers in some local government areas of Osun State are busier than most, but it's obvious the facilities have seen better days. Collins brings his daughter for treatment and hopes that his pregnant wife will deliver another baby in the only primary healthcare center in Avu local government area of Imo State, southeast Nigeria.
The best of their capacity, they tried to make sure, as you can see now, she's very, very healthy. And my wife is pregnant again, and I've still brought her here again. So what I think the government should do for them is to improve them. As you can see now, they are lacking basic amenities like light.
Residents, medical staff, and even the state government agree that Kaduna primary healthcare facilities leave much to be desired at the moment. But the State Health Commissioner explains that there's been an unprecedented level of investment in the sector. In spite of the inadequacies, residents at Lugbe village in Abuja see the center as a lifeline. The Minister of Health, who visited the facility in Kuchingoro village in Abuja, intends to raise the standard of at least 10,000 centers across the country.
What we want to do is to bring health to the doorstep of our people. And the only way to do that is to deliver her through a network of functional PHCs. And this one represents one of the PHCs that we tend to have all over the country.
It is reported that 1% of the consolidated revenue would go to the health sector, and some of this money will trickle down to primary healthcare centers all over the nation. Perhaps then more people will receive better services at the grassroots level. Mary Alale Yusuf, Channels Television News.
Let's take this discussion further. I have joining me on the news at 10, the Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter, Dr. Doyin Odubanjo. Thank you for joining us on the news at 10.
It's a pleasure. Good evening.
Good evening and Happy New Year to you.
Same to you.
Let's get your reaction on the suspected outbreak of polio in Cross River State, as we have seen in the reports before now. How much of a setback could this be for us as we strive to achieve polio-free status?
Well, I think we shouldn't, first and foremost, we shouldn't rush to conclude. We should wait for the test, really, because you can't tell just by looking to say this is polio. So we need to wait first for this test to come out, and then we can start talking about how bad this is. If it is confirmed, it's really bad, because that means we have to wait longer before Nigeria can be declared to have eradicated polio. And that means we have also set back the global agenda. Perhaps by many more years.
But this will not, this acquisition of the status will not be dependent on Cross River State. This is in combination with the cases that were discovered last year in Borno State, right?
Right, but then it's about timing. You know, so if you look at what was discovered in Borno, they start counting from then to say we don't have any more cases from XY date. You know, but now we have a later date of a case. So if it is confirmed, then you start counting from now, not from when you saw the last case in Borno.
Okay.
Right.
Now, supposing the results, as the Commissioner for Health in Cross River State has said, supposing the results turn out positive, you know, at the end of the day, after the analysis and diagnosis has been done, what should be done from there?
It means it's back to the trenches. We have to go back to all of the same strategies that were being used. You have to have mop-up vaccination campaigns around that vicinity. And indeed, it also means that we need to further check what we have been doing around there. Because basically, it looked like what we had concluded before was that the main problem was from the northeast, which we didn't know much about, given the war in that area. But if we have now in the south-south, then it raises new questions about what we've been doing and what we need to do now.
And that also raises the issue of primary health care, as you know, some of the responders in that in some of the reports that we just listened to also talked about some of the facilities that are missing, you know, in these institutions. How did we get to this point where our primary health care facilities are actually lacking basic infrastructure?
I think it's a question of priorities. You know, in Nigeria, we pay a lot of lip service to health care. Care has been important. But it's not as important as we say it is to us, really, because it's like, again, taking the war against terror in Nigeria. We thought it was important, we said it was important, but we can tell the difference between last year and this year when we really know that it became important. You know, so it's the same way. Over the years, we've said healthcare is important, but all of us can tell appalling stories of facilities, equipment, human resource, at health centers close to us, wherever we live in Nigeria. So we haven't paid enough attention. Once it becomes priority for real, we will do all the right things because we know what to do, really.
You think this polio scare could help trigger that interest and push up the priority?
Well, that would be a good result. You know, if we did get that to trigger that, that would be fantastic. You know, Ebola didn't trigger it sustainably. It triggered something, you know, but it's not been sustainable. But I always like to use that example to say then we saw what happened. The political will, the funding, the equipment, we saw how things were being supplied, you know, to make things work because everybody was afraid and wanted to get away from Ebola. So the same way now, if this can push us really, it will be a fantastic result.
Dr. Doyin Odubanjo, it's been a pleasure speaking with you tonight. Thanks for joining us.
Thank you.
Dr. Doyin Odubanjo, the Chairman, Association of Public Health Physicians of Nigeria, Lagos Chapter. In part two, after the break, Nigerian Army announces plan to establish presence in southern Kaduna to check communal clashes in the area. That's in a moment. Please join us again.